አዲስ ቅኝት መቀመጫውን በቶሮንቶ ያደረገ የመረጃና የመዝናኛ ሬዲዮና ፖድካስት ነው። አዲስ ቅኝትን አዳምጡ፣ በአዲስ ቅኝት ተናገሩ።
Welcome to the Newperspective radio show and podcast and the YouTube channel. Dr. Hailemeskel or Dawit Hailemeskel. Tell us about yourself a little bit and how you grow up, where do you grow up, and how do you study medicine?
Yeah, sure. So a little bit about me. So I've been raised in Toronto mostly in the northwest side of the city, so near Keele and Finch. And I went to school around there. I ended up studying kinesiology and health science in my bachelor's degree at York University. After that, I ended up applying to McGill Medical School.
Yes.
And that's where I got my Doctor of Medicine. And after that, so that was for 4 years. And after that, I studied at University of Toronto through my family medicine residency, and I'm completing that in July of 2020. I enjoy playing basketball, enjoy music a lot, and just hanging out with friends in terms of my hobbies. And when I'm finished my residency in July, I'll be working in urgent care and in palliative care.
That's really wonderful. Congratulations for completing your program at the university, and now you are a full-time family medicine doctor at the St.Joseph Hospital, family medicine department.
Right. So I have a family practice, but that's through my residency.
Yeah.
Where I have patients that I follow once a week, and that will be until July of
Okay.
And then the practice gets passed on to another resident.
Okay, that's great. Is there anyone who studied medicine in your family, or just you?
Yeah, so I have two aunts who are in medicine, Dr.Dawit Hailemeskel and Dr. Hailemeskel, who both practice in Toronto.
Okay, so do they inspire you to become a doctor?
Yeah, so good question. I think indirectly, seeing them in that role has made me consider that as a position. But I do think that overall it was, I decided to do it pretty independently. I didn't have any pressure or anything like that.
Yeah. Just, positively they inspired you.
Yeah. I think maybe just by seeing that they were able to, have success in the field, showing me that, it was possible.
Okay. Do you have any relation in the Ethiopian community, in the diaspora, in any way, through your practice or through your family?
Yeah, of course, right. So, my family is quite involved in the Ethiopian community. They go to St. Mary's Church quite regularly. I grew up in the church as well. And a lot of my family is a diaspora from Ethiopia living in Toronto. So definitely have some connections there. Yeah.
Okay, so let's come to our today's point of discussion. That's COVID-19 and family medicine. It's very difficult, to do your job regularly. How do you explain it? How do you explain this time?
Yeah, so I'll start off by saying that I think that overall, as a society, we've done quite well in managing this outbreak. Of course, there was a lot of anxiety and a lot of unknown factors that were putting a lot of pressure on the healthcare system. One of the main pressures that we had was not having enough personal protective equipment. So face masks, gowns, that type of thing. We have been able to improve access to this equipment, which is which has alleviated a lot of anxiety and stress amongst healthcare professionals. So that was one big issue. The next issue is that, there was a lot of misinformation about how the disease is spread, how contagious it is, how deadly it is. And we're starting to get those facts more and more as time goes on. And those facts are being passed on to the population and to the society. And I would say that if you were interested about this topic and understanding more about COVID, two good resources would be the CDC and the WHO. They have the most accurate information. So those are the two main things that, I think, the healthcare professionals were a bit scared about. But, we still go to work every day, and we wear a face mask anytime we're in the hospital. We practice aggressive hand hygiene. We don't, spend time in close proximity to another person. So we try to stay at least, 2 meters away at all times. But, it's business as usual at the hospital. We still have to work. People still get sick. So that's my perspective.
As a frontline professional, they are exposed, medical professionals are exposed in this virus, and they have been working tirelessly. So what's the most difficult challenge for you in this pandemic?
Yeah, so I think there's a balance, right? I mean, I never regretted becoming a doctor because of this pandemic. However, at the same time, in order for me to be useful to society, I have to be alive and healthy so I can treat other patients, right?
Yeah.
So, of course, I think we're all courageous, but we also have to be smart with how we approach a virus that we don't know a lot about, right?
Yeah.
And I think the way to be safe is to protect yourself, right? So protecting yourself with a mask, protecting yourself with gloves. And this is just for people in the hospital. This is not for people walking around outside or anything like that, because the risk is very low in those types of scenarios and settings. But if you're working in a hospital and you're working with sick patients, you should always protect yourself. So I think a lot of the reason I personally was scared initially is because there was a shortage of the personal protective equipment. So there was problems with getting access to this equipment. So a lot of us felt unsafe working in environments where we might be exposed, but we can't protect ourselves. This, however, has been improved greatly over the past month. So it's less of a scare now, because I know that when I go to the hospital, I have access to the masks, and to the other protective equipment that's necessary.
So you say that it's business as usual for you, and how do you follow up your clients and your patients? Can you tell me how?
So especially in family medicine, one way that we adjust is we're doing a lot of telemedicine. So we can call patients through the telephone, which I've been doing with you, of course, and the family. And we're able to connect with people very quickly and very efficiently over the phone. Of course, there's some limitations. We can't do the physical exam. But there are many things that we can do in family medicine over the phone. So again, I would even encourage all the listeners, if you have any medical issues, call your family doctor, because a lot of times it can be handled over the phone. And if not over the phone, there's a video. There's different video conference platforms where you could actually see each other.
Oh, we didn't use that so far, but I can witness that you are doing a great job through the phone and following up the issues in the families. So what's the most difficult health problem in the family medicine area during this pandemic that you face?
Yeah, so the most difficult health problem, I don't know that there's one most difficult health problem related to family medicine. I think overall the most challenging health problem, of course, for everybody in medicine is coronavirus, right? Controlling that and controlling the spread of that is the most serious thing. But I can say that a big challenge that we're facing in family medicine is having to make a decision on whether the patient is healthy enough to stay home or whether they're so sick that they need to go to the emergency department. sometimes it's hard to do that if without doing a physical exam, without seeing the patient, without touching the patient. Oftentimes we have to make these decisions with less information, and which sometimes can become challenging.
As a medical person, there are times that you decide on the life of, who dies and who continues. That's the most crucial question in this pandemic. So what do you decide when you happen to in this situation? I mean, can you tell me what's the ground you are based on?
Yeah. So you're asking all the juicy questions. I think that was actually one thing that I was very scared about, is having to make those ethical decisions, right? But luckily we haven't had to make those because of social distancing, because people are staying home, because we were able to flatten the curve. We didn't have to get to the point where there were not enough healthcare resources for all the sick people. Now, can that happen in the future? It's very possible, right? If we don't get a good hold on coronavirus, it may get to the point where we have to make these types of decisions. But luckily, from my experience, we haven't had to make these decisions yet. But when we do have to make them, or if we do, hopefully if not when, there is a framework of deciding, and it's an ethical framework, and it involves multiple different professionals, not just doctors. It involves the patient, it involves the whole team, and then there's a very much a stepwise process to go through the difficult ethical dilemmas.
Yeah. But as you are part of the Ethiopian community in Toronto, and back home in Ethiopia and in Africa, things are getting as usual now. People are forgetting about taking care of themselves, staying at home. So I hope some people will see this interview when we put it on YouTube. So what do you advise for people who take it easily, who take it for granted?
Yeah, so I would start off by saying is, I can sympathize and understand why somebody would say, what is this coronavirus? This is disrupting my life. It's disrupting my job. And, I don't see why this is so serious, why it's so different from a flu. But, the reason that they think like that is because they actually haven't seen it in real life, right? And I've seen it multiple times with multiple different patients. And I can say that it is a very serious thing, especially for people who are elderly. It's very important that we get a better control over it, or things can get a lot more serious and a lot worse, because this is a very contagious virus, and it has very bad outcomes on elderly patients, right? So our grandmothers, our grandfathers. So because of this, I think that it's very important that we take care, and just follow the guidance that we're getting from the officials who know a bit more about about the coronavirus.
What do you think the most difficult thing is when it comes to accepting the advice from medical professionals?
So I'm not sure, because but I would always be interested in hearing what it is from the patient's perspective. I think it's different for every patient. Sometimes there might be a level of mistrust with officials. Sometimes there might be a level of skepticism, right? So I think there's a combination of different things. Sometimes you hear about conspiracy theories. So there are lots of different reasons why people might not trust the healthcare officials, maybe based on previous negative experiences. So I think there's a lot of different reasons, but I think it's different for everybody.
Historically, we read that the second wave could cause more danger than the first one. So what's science tell us? What do you tell us about the coming of the second wave of the coronavirus? Is there any prediction, any estimation?
Yeah. So I'm not sure that we quite know yet, right? It's all speculation at this point. However, I think that the most important thing is public health closely monitoring it, testing people as much as possible, so we can have a really good idea of the numbers. And once we have control over the numbers, and we know who has coronavirus, we can take the appropriate precautions in order to prevent it spreading further, and hopefully preventing a second wave. Or even if we do end up getting a second wave, having the healthcare facilities to handle it.
So it's better than the previous one. There is a capacity to control it down. That's what
I hope so. I hope so. Yeah. So I mean, the measures that we put into place are going to determine if we have how severe a second wave will be, right? So it all depends on what we do as a society between now and then.
Okay. And how's life looks like for you, for medical professionals, for your age? You are young and a young doctor, and you have friends, so you are challenging this time. You are supporting the community. So what do you discuss? Do you have time to share ideas other than the COVID-19 issues?
Yeah, we try. We try, but obviously COVID-19 has taken a large part of our lives. But I think we've been trying more and more to have more of a balance. In terms of work for young doctors, it is challenging for us too at this point, because medicine itself has changed a lot because of coronavirus. Less people are going to clinics. Less people are going to walk-in centers. Less people are leaving their house, right? So, it is, in a way, it is a crazy time for medicine as well as every other field, right? Where people have decreased amount of work. So right now it's pretty crazy, but I think things will change soon, and hopefully things will slowly get back to normal.
How do you spend your time? When you have a day off, what do you do?
Yeah. So, when I have time off, I like to, sometimes I'll go on a jog by the lake, take a bike ride. Before coronavirus, I was playing basketball. Like to watch Netflix like everybody else. I like to read as well, so I try to educate myself on fields outside of medicine as well. So I'd like to read.
What do you read? What do you have any recommendation? Is there any books that you recommend? You are reading now?
Not recently. I've been reading different books about the economy, trying to educate myself on that, because we don't get much formal training about that.
Do you have anything that you can say at the end of our conversation? Any message or anything?
Yeah, of course. Yeah. So yeah. So I think the most important thing is try to wash your hands as much as you can. It's actually very, very effective. Try to stay 2 meters from somebody. So if possible, that's very important. You don't necessarily need to wear a mask every time you go outside, every time you go grocery shopping, because the risk is very low. But try to keep your distance from people as much as possible. And those are really the basics on how to prevent the spread of coronavirus. And try to stay as positive as you can. It's a very stressful time for everybody, but I think things will get better, and we will get through this.
And how about for the younger generation in the Ethiopian community? I think they want to hear something from you.
Yeah. So for any young person in the Ethiopian community who is interested in medicine, or whoever just wants to talk about anything, I'm always open and willing to help out. So you can connect through Gezahen, who will share my contact information, my email, and I'm always happy to talk to anybody.
Thank you very much, Dr. Dawit Hailemeskel, for joining us in our radio show, New Perspective. I wish you all the best in your career and in your time through this pandemic. I hope we will talk soon in another issue.
Of course. Okay. All right. Thank you, Gezahen. Thank you for having me.